I'm Heidi Arens, and I'm a nurse practitioner here at the Center for New Medicine. I'm going to be talking today about leaky gut, or the other name we call that is intestinal permeability. So a lot of you have questions about leaky gut. What is it? How do we test for it? How do we treat it? And why do I care? Basically, leaky gut is a very important topic. Hippocrates said all disease starts with the gut, and that's because our gut hosts the majority of our immune system comes from our gut. Our gut makes serotonin that then our brain uses. So our gut has just hundreds of different actions, especially for our immune system, which I'll be talking about today. So what is leaky gut? Leaky gut, the other name for that is intestinal permeability, and that's when the lining of our intestine becomes permeable or leaky. The tight junctions that are proteins that hold an individual cell together start to separate. So if you think of a row or stack of bricks, they're held together by cement, or a line of tiles is held together by grout so that nothing can get in them. Our intestinal lining is similar. It's made so that it can take in nutrients, but not the toxic things that we don't want into our bodies. So our gut lining is actually one cell layer thick. And so it's made so that we can take in nutrients from our food, and those nutrients can get broken down and through that intestinal lining. But it's not so permeable to let in things like bacteria and fungus and parasites and viruses, or even chemicals, other toxins that we could have contaminated in a food or beverage or somehow get into our intestinal tract. Medication, we don't want some of those toxic metabolites being absorbed. So why is this so important? Well, when our gut lining is intact, it creates that wonderful barrier. It allows food and nutrition in, but it keeps toxins and bad things out. When those cells become more permeable, or the tight junctions in between those cells become permeable, we then get things that shouldn't be in our bloodstream. They can get allowed in because of those tight junctions that are now apart. So why is this so important? Well, when we have various things that start to attack our gut lining or create inflammation at our gut lining, our immune system that's right on the other side of our gut lining gets activated. And when our immune system gets activated, it creates a host of immune challenges. A lot of times antibodies get formed to those particles that should not be allowed into the gut lining. Also, inflammation can start to brew, and it disrupts the way our gut functions. It disrupts the ability to take in nutrients. It also creates just a ton of inflammation that then gets access to the rest of our body. So what I want to talk about today is just a couple things that can contribute to leaky gut, and then what can we do to heal leaky gut. So there are a lot of different things that can affect our gut lining. One of the biggest things that we all encounter every day is stress. Stress breaks down our tight junctions. It creates inflammation at our gut. It creates an exaggerated immune response in some ways, and in other ways it can suppress our immune response. So stress is a big trigger. Also, anything that's a toxin to the gut lining, that could be glyphosate, that's one of the active ingredients in the herbicide Roundup that's on most processed foods today. GMO foods, toxins like alcohol, many medications can actually tear down the lining of our gut or create inflammation in the gut that then can wear down the lining of the gut. Things like non-steroidal anti-inflammatory medications, NSAIDs as we call them. Those are things that a lot of people use over the counter for pain or inflammation or headaches. Ibuprofen, Motrin, naproxen, Aleve, aspirin. All of those medications can actually wear down the lining of the gut over time. Steroids can contribute to that as well. Antibiotics, because it creates a dysbiosis or an imbalance of good and bad bacteria that then can wear down that lining. There's a lot of other medications that we can take, antacids being one of them. When you don't have enough stomach acid, you don't break down food very well, and that can have implications later to the intestinal tract as well. So there's a host of things that can start to break down the gut. Another one that's common is SIBO, small intestinal bacterial overgrowth. It can create a lot of toxic byproducts and putrefaction of proteins and carbohydrates that get basically fermented, and all those toxic metabolites can start to wear down the gut lining. And so what you're left with is this gut lining that's leaky. It's now you're not getting good nutrients in, or you're just getting too many things in that shouldn't be there. Like, for example, you eat an egg, you don't break down that protein very well, and you have a leaky gut. Those protein molecules can now fit through that gut lining. When it does so, it activates the immune system. The immune system goes, what's that? What's that? What's that? That shouldn't be here. So it mounts a response against what it thinks is a foreign object trying to hurt us. And it creates an antibody that alerts the immune system, hey, this is bad. We need to go after this thing. And if that goes on day after day, month after month, year after year, you have a ton of inflammation starting to happen. The other thing that happens is your immune system is now activated, or what we call primed. And when that happens, those antibodies are starting to get formed and they float around the body. When those antibodies are in such great numbers, over time, through a process called molecular mimicry, those antibodies can start to attack tissues that happen to look a lot like the original object that the antibodies were formed against. And this can take months or years to develop, but that's one of the beginning stages of autoimmune disease or autoimmune conditions. So now we have this overproductive or overactive immune response occurring that can then start to attack body tissues. If it happens in the gut, it can create ulcerative colitis or Crohn's. If it happens to the sheath around our nerves, it creates MS or multiple sclerosis. So depending on where those antibodies attack, it could create a autoimmune condition in another area. Maybe it's the thyroid, Hashimoto's, or Graves' disease can affect the thyroid, and you have an autoimmune attack on the thyroid gland. Well, if you trace back what was happening months or years before, it could have been that there's a leaky gut at the root of it. And so what we want to do is we want to identify these things, and then we can treat them. We can heal leaky gut, we can create the tight junctions and make those cells less permeable and much stronger again, creating a much more robust immune system. So what are the things we can do to test for this? There are blood tests that we can do. There are also stool tests that we can do to start to look at markers of leaky gut. One of those tight junctions, there's a protein in there called zonulin. And when you have permeability, loss of those tight junctions, the cells are starting to come apart, zonulin gets released. And that's something we can detect either on stool testing or in the bloodstream. There's a number of other proteins that we can also detect, but that's one of the more common ones that we look for. Formerly we had tests, mannitol tests and lactulose tests that we could check, and that was kind of one of the beginning things that we could use before we had these more substantial markers that are easier and cheaper to test. But there's a number of things that we can do either in the blood work or in a stool test to actually identify leaky gut. One of the other things that we can do also is look for food sensitivities. What happens is when you have a leaky gut or intestinal permeability, all of a sudden, food that isn't being broken down very well starts to get through those tight junctions and into the bloodstream, and our body mounts a response to that. It can be a sensitivity, it can eventually turn into an allergy depending on what antibody is responding, but we get a lot of food sensitivities when we have leaky gut. So some people will say, I grew up eating everything under the sun, never had a problem, had a gut of steel, could eat anything, never had gas or bloating or constipation, diarrhea, upset stomach, any kind of symptom whatsoever. But now I try to eat an egg and I react, I get rashes or I get bloating. Or I try to eat bread, and I used to eat bread my whole life, and now I can't eat anymore. Dairy. I used to eat dairy my whole life, never had a problem. Well, now I have all these food sensitivities. Soy is another one that's a common food sensitivity. There's some shellfish or even peanuts or other nuts that people have very high sensitivities to. What's going on there? Well, that's a clear sign that there's a leaky gut going on. If you have 1 or 2 sensitivities here or there, it's not so concerning. But when you have 4, 5, 6, 7, 10, 20, 30 sensitivities to all these different foods, that's a big sign that there's a leaky gut going on somewhere. And we need to identify that and treat it. So if you're someone that's had a lot of food sensitivities, or you're starting to get a lot of gut symptoms that are nagging and frustrating and really affecting your quality of life, you should consider leaky gut as maybe one of the causes. Some of the symptoms are bloating after meals. You feel full, you feel just uncomfortable, you don't feel like you're digesting your food very well. You can start to get heartburn, you can get gas, you can get constipation, you can get diarrhea. Some people have mixed constipation with diarrhea. It's alternating one and then the other. So there's a host of symptoms that people deal with, and they use a lot of medications to try to mitigate those symptoms. But what's really going on upstream is that there's a leaky gut that is not being resolved. And so those are things that we want to know about so we can start to address them. We can test for them, and then we can start to treat them. So that being said, some of the treatments for leaky gut, there's a host of things we can do. One of the more common ones that we use here in the clinic is Restore for Life. It's literal atoms that help to restore the tight junctions. There's a number of products either in capsule form or in powder form. Immunoglobulins is another one that we're starting to use more and more in a powdered form that can start to calm down the inflammation and tighten up those loose junctions. There's a host of other things like L-glutamine, which is fantastic. It's an amino acid that can start to rebuild the lining of the gut. The other thing that we would need to know is, are you digesting protein very well? Because if you don't have enough hydrochloric acid to digest protein, you don't have the building blocks to help to restore that leaky gut to those amino acids that are going to start to build that lining back up. So that's another thing that we want to look at. What we do is what we call a 5R program. And that's one thing that we can do to help remove the bad things and start to repopulate the gut with good, healthy things to heal it, to calm down inflammation, and to start to heal up those tight junctions, to calm down the food sensitivities and the ongoing inflammation that's giving you the symptoms that you're experiencing. We want to get rid of any pathogen that could be also creating leaky gut. That's things like yeast overgrowth, bacterial overgrowth, or an imbalance of good and bad bacteria or good and bad yeast in the gut. We call that dysbiosis. And when there's an imbalance going on, the immune system of the gut, the microbiome of the gut gets affected. So we want to help to identify those things and restore them. We want to remove the things in your diet or your lifestyle that could be contributing to a leaky gut. Alcohol, stress as much as possible. Caffeine, coffee, sometimes that can be very irritating to the gut lining. Antibiotics, ongoing medications like antacids, pain relievers, NSAIDs. All those things can start that wear down the gut lining. We got to get rid of so that we can give the gut a chance to heal. So part of this is removing the bad stuff, and then we need to start to put in the good stuff. We need good, nutritious foods that you're not sensitive to help heal the leaky gut and also calm down the immune system, calm down inflammation so that your gut has a chance to heal. If it's constantly inflamed by food triggers, then it's never going to heal. So we have to give time, usually a few months, away from the foods that are very irritating to the gut to allow all that to calm down. Sometimes we need to do what we call an elimination diet, where we take all the food sensitivities that you're sensitive to, including all the typical allergens or things that people are sensitive to, and we get rid of those things for at least 30 days, just to calm down the inflammation and the immune activation. Then we can reintroduce those things once the gut has healed a little bit. The other thing that we want to do is we want to create an immune response that's healthy. So if you don't have enough vitamin D, if you're low on certain nutrients, if your immune system has been just suppressed by too much cortisol because of your overdrive, your sympathetic overdrive and your stress, then we need to address each and every one of those things so that we can start to take the burden off the intestinal tract. allow it to heal, calm down that inflammation. So I invite you to please ask questions. I'd love to know, what questions do you have? What are you curious about? And if I can do anything to answer those questions and clarify anything for you. We treat a ton of patients here with leaky gut. And I will say that when we look at patients that come in with end-stage cancer, or they have a new cancer diagnosis, or a new diagnosis of an illness, or a new autoimmune condition, this is one of the places that we start, because we have to create that gut barrier. We have to tighten up those loose junctions so that everything else can start to fall into place. Your therapy, no matter what you're dealing with from a medical perspective, everything's going to improve when we get the gut healthy. And so we can transform even people who have a host of symptoms when they come in, just cleaning up the diet, cleaning up the leaky gut, calming down that inflammation. The majority of symptoms go away. It's pretty amazing. So I invite you to ask questions. If there's anything that's still unclear, anything you want to know more about, let me know. I'll answer those questions here on Facebook. And then I invite you, if you want to look further and dig deeper in this topic and you're concerned about you or a loved one who could have leaky gut, please come and we'll help you.